Welcome back. There are more than 7,500 cases of monkeypox in this country, still mostly in men who have sex with men, but cases have also presented in children and in women. One ER doctor in San Francisco is sounding the alarm now. He tells NewsNation about 1 in 4 of the monkeypox patients he's seeing were misdiagnosed and had their symptoms missed by another provider. These patients land in his ER often in excruciating pain. Dr. Graham Walker is joining us live now. Dr. Walker, thank you so much for being here.
Thanks for having me.
You know, I want to start with this misdiagnosis issue that you're seeing. How is it that 1 in 4 have had their symptoms missed by another provider? What's going on here?
Yeah, it's a great question. The new monkeypox that we are seeing is presenting differently than what you might see in a textbook from even 5 or 10 years ago, with different numbers of lesions, different presentations that the patients are having. If you look in a textbook, you may see that patients always have a fever or lymph nodes or night sweats or fatigue prior to developing a rash, and that's not really the case anymore. So we're just learning how to properly diagnose this and make sure we don't miss it.
And I mean, you told us that for some, this is excruciatingly painful. One of your patients can't lie on his back. Another can't even wear pants or underwear. And this leads us to another point that isn't being covered enough right now. There is a treatment, a medication called Teapox. And you say that it can be the difference between a person being in that kind of agony for a month and having their lesions close in as little as 3 days. So I want to ask, as a doctor, do you have the access you need to this medication? How hard is it to come by?
Thank you, Natasha. That's honestly the big reason that I've started to speak out about this is I do not have the access to Teapox that I need. Teapox is still under a FDA and CDC IRB or review board requirement, which requires about 15 pages of paperwork, about 200 questions to be answered per patient, and it takes about 2 hours per patient to fill out this paperwork. So one of the things that I think is most important is that doctors like myself be able to prescribe Teapox, or tecovirimat is the generic name, to patients who have a high likelihood of having monkeypox based on very classic lesions like the ones I'm seeing as an emergency doctor, or have a confirmed test as well. Right now, it takes way too much paperwork for me to be able to get this medicine, which can reduce the amount of time that a patient has these symptoms, and theoretically also reduce the amount of time that they're infectious or contagious or can spread this disease to other people.
Oh, absolutely. I mean, how frustrating is it as a physician to send a patient home in that kind of pain and say, here's some pain medication, have, good luck over the next month. And especially a lot of people can't even take a month off of work, let alone, it's just one of the issues. How frustrating is that for you?
That's right. These patients often have symptoms or lesions for 3 to 4 weeks. I don't know anyone that has 3 to 4 weeks of sick leave time to just be off and not working, let alone isolated from friends and family and other people. So it's a major problem. I'm an emergency doctor. I work nights, weekends, and holidays because I like fixing things and I really just love helping people. But it is so frustrating to be hamstrung by bureaucratic paperwork when I feel like I can very easily prescribe this medicine safely to the appropriate patients. Any medicine that's FDA approved without this carve out like tecovirimat has can be prescribed off label by a physician. I do this every single day. I do this with Paxlovid, numerous other medications, and I know how to weigh risks and benefits and safely provide this to patients. And I think Teapox should be no different.
Yeah. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.